Cancer rarely appears suddenly. In most cases, it develops quietly over many months or even years, sending subtle signals long before a diagnosis is made. The problem is that these signals are often vague, easy to ignore, or mistaken for harmless everyday issues. The goal of this video is not to scare you or create anxiety. Instead, it's to give you clear, practical guidance on when it's important to see a doctor sooner rather than later, instead of postponing a medical checkup for months. I'll also explain how cancer develops, what factors contribute to it, and why early detection is so critical. Along the way, I'll introduce you to some remarkable cells inside your body, true biological superstars that play a powerful role in detecting and fighting cancer. Understanding how your body works helps you recognize when something may be wrong. To understand early warning signs, we first need a basic idea of what cancer actually is. Under normal conditions, your cells follow a tightly controlled life cycle. They grow, divide, and then die once their job is done. Cancer disrupts this balance. Cells continue to grow and divide, but they no longer shut down when they should. Over time, these abnormal cells accumulate, forming tumors. In some cases, they spread to other parts of the body, creating metastases. One of the biggest problems caused by this uncontrolled growth is chronic inflammation, which damages surrounding tissue and interferes with normal organ function. This explanation isn't meant to frighten you. In fact, it highlights why cancer symptoms are often difficult to treat once they become severe. By the time strong symptoms appear, a tumor may have been growing silently for years. That's why recognizing early warning signs matters so much. Sometimes a simple doctor's visit, blood tests, or imaging can rule out serious problems or catch something early when treatment is most effective. One of the most commonly overlooked warning signs is unexplained weight loss. This typically means losing about 10% of your body weight within 6 months without trying. Many people feel happy about this and assume it's a positive change. Unfortunately, unexplained weight loss can be associated with cancer. Possible causes include nutrient deficiencies, chronic diarrhea related to colon cancer, or difficulty swallowing, which can occur with tumors in the throat or thyroid. Because it often feels like a benefit, this symptom is frequently ignored or dismissed. Another key warning sign is a recurring fever. If your temperature repeatedly rises above 100.4 degrees Fahrenheit or 38 degrees Celsius without a clear cause and lasts for weeks, it may signal an underlying inflammatory process. Tumors can release inflammatory substances that trigger persistent fever. Many non-cancer conditions can cause fever, but fever that keeps returning without explanation should always be evaluated, especially when combined with other symptoms. Unintentional weight loss, persistent fever, and night sweats together are known as B symptoms. These are some of the most important early warning signs doctors watch for. A large percentage of cancer patients experience one or more of these symptoms early in the disease. When all three occur together, they may indicate blood-related cancers, such as leukemia or lymphoma. Long-term changes in bowel habits can be an early sign of colorectal cancer, which often develops silently. Warning signs include pencil-thin stools, chronic diarrhea or constipation, blood in the stool, persistent bloating combined with loose stools. Screening tests, such as stool tests and colonoscopies, are extremely effective at detecting issues early, often before symptoms appear. Fatigue that does not improve with rest and lasts longer than 6 months should never be ignored. Cancer-related inflammation interferes with energy production at the cellular level. Tumors can also disrupt metabolism and cause nutrient deficiencies, leading to constant exhaustion. While fatigue is common and often harmless, persistent fatigue without explanation deserves medical evaluation. Your immune system includes powerful cells called natural killer cells, which help detect and destroy cancer cells and virus-infected cells. Swollen lymph nodes are common during infections, but lymph nodes that remain enlarged for more than 3 to 4 weeks should be checked. If lymph nodes grow rapidly become hard, exceed about 2 centimeters, or appear without infection, medical evaluation is essential. A cough that lasts for weeks without a clear cause should not be ignored. If a cough persists all day, gets worse at night, is not linked to infection, or involves coughing up blood, then medical evaluation is necessary. Imaging and blood tests can help identify serious causes early. Difficulty swallowing is often underestimated, but it can be a significant warning sign. Swallowing is a highly coordinated process involving muscles, nerves, and finely tuned reflexes. Tumors in the throat, esophagus, thyroid, or surrounding tissues can disrupt this process by pressing on nerves or muscles. Inflammation, swelling, or tissue changes can also interfere with swallowing. People may notice food getting stuck, pain when swallowing, or the need to swallow repeatedly. If swallowing difficulties persist for weeks, especially without an obvious cause like a sore throat, they should always be evaluated by a doctor. Pain that appears without a clear reason or does not improve over time can be another early warning sign. Tumors can cause pain by pressing on surrounding tissue, compressing or damaging nerves, causing inflammation, spreading to nearby organs. In some cases, the primary tumor causes few symptoms, while metastases cause significant pain. This is why pain should never be dismissed simply because imaging once appeared normal. Persistent pain that worsens, changes character, or appears without explanation should always be investigated. Skin cancer is increasing worldwide, making skin changes one of the most important warning signs to watch. You should monitor your skin for moles that change shape, color, or size, irregular or jagged borders, bleeding, crusting, or non-healing sores, new spots or growths that appear suddenly. The ABCDE rule is often used: asymmetry, border irregularity, color changes, diameter increase, evolving over time. Regular skin checks and early evaluation dramatically improve cure rates. Today, digital dermatology tools allow quick assessments, and suspicious changes should always be examined by a professional. This video is not about fear. It's about awareness and action. Listening to your body, recognizing early warning signs, and seeking medical advice early can save lives. Often, a simple checkup provides reassurance, and when something serious is found early, treatment outcomes are far better. If you found this video helpful, please like, subscribe, and share it with others, and consider becoming a channel member. Thank you for watching, and I'll see you in the next video.